Elbows, tricep.
We are testing the tricep to determine if there's subluxation. Okay, that's strong. That's a good muscle indicator. If you will flex your wrist, please. We are now testing the ulna. And if it goes weak, then we're going to therapy localize either medial or lateral. If he's on the medial side, we're going to keep him flexed. And if that goes strong, we're going to adjust this way. That way. Okay? And if he therapy localizes on the lateral side, we muscle test it, and it's strong, then we're going to do the opposite and go anterior lateral. This is going to be an anterior lateral adjustment. Going to get under the olecranon, go straight up. Okay, now we're going to test for the radius, put the wrist in extension, and if that goes weak, then we're going to do brachioradialis test. If that's strong, we're going to adjust from the radius where we find the radial head. We're going to slip off. And if the brachioradialis test was weak, then we're going to find the radial head again. And we're going to stick it. Okay. And we're going to recheck them. And if we take it into extension, it's now completely strong.
Alright, shoulder, anterior humerus.
Okay. We're going to test it for an anterior humeral subluxation.
Sorry, anterior inferior.
Okay. And this is strong, so we're going to take it down a little bit farther in the superior 45 degrees. We're going to test it. And if that goes weak, we're going to use supine alternate number 2. We're going to take it into that same angle and adjust that way. Okay. And then we're going to post-check that, make sure that's strong. Then we're going to take it down to another 45 degrees. And if that goes weak, then we're going to have him sit up and do a seated adjustment for a better angle. Down. Okay.
AC corpobrachialis.
Contact is pretty much
Okay. If I can have you lay down again, please, sir.
contact.
Okay. We're going to go 45 degrees up and 45 degrees out. And we're going to have him resist. Okay, and if that goes weak, then I'm going to have you sit up again, please, sir. I know this is not convenient. Okay.
SC joint.
Okay, if I can have you lay down, please, sir. I apologize for all of this. We're now testing the SC joint. Go out here. We're going to push it in this direction. Okay, and if that falls weak, we're going to lay him on the side that was weak. So if I can have you in right side posture. And before we do this, we're going to test whether it's superior or inferior. If it is inferior, then we're going to adjust in a superior direction. And if it is inferior, we're going to adjust from... And if it's superior, we're going to adjust inferior. I apologize. Okay. I'm going to hold the patient's head. We're going to go and push it in that direction. Okay.
And posterior humerus.
And now we're going to check for posterior humerus. If I can have you lay on face down, please, sir. I'll stay on this side. If I can have you put this arm on your back. Okay. We're going to push this way. And if this falls weak, then we're going to take it out this way. If I can have you slide to the edge of the table. We're just going to go straight P to A. And you have to be careful. And then we are going to recheck that and make sure that went strong. And it's now strong.